Hey everyone, welcome back to my channel. Today I want to dive into some Reddit posts that talk about different medication errors and dissect the outcomes of these mistakes. If you have any takes on these outcomes, feel free to leave a comment below. Let's begin. Well, that's horrible. We have a thing in our region where we dispense prednisolone liquid in original packs only. A pharmacist accidentally gave risperidone liquid instead a few years ago somehow, and the child ended up with permanent disabilities. What is prednisolone? Prednisolone is classified as a steroid. It is used as an anti-inflammatory or immunosuppressant agent in the treatment of a variety of diseases, including allergic, dermatologic, GI, inflammatory, etc. Basically, it helps by reducing swelling and can also calm down your immune system. It is typically used to reduce fevers and help with asthma attacks in young children. What is risperidone? Risperidone is classified as an atypical antipsychotic agent, mainly used in bipolar mania, schizophrenia, and irritability associated with autistic disorder, that are theorized to be caused by an excess of dopamine receptors. It works by relieving psychotic symptoms via dopamine D2 receptor antagonism. So what happened that such an outcome could be possible? This could have been for a multitude of reasons and would also depend on if the child was taking the medication long-term or on a short-term basis. Long-term complications of taking antipsychotic agents include hyperprolactinemia, long-term metabolic changes, orthostatic hypotension, priapism, low white blood cell levels. I believe that the likely diagnosis of this long-term disability may have been due to the development of tardive dyskinesia, or NMS, neuroleptic malignant syndrome. Let's start with NMS. Neuroleptic malignant syndrome can happen from a single dose, increasing a dose, or the same dose of an antipsychotic medication. Neuroleptic malignant syndrome is a rare and potentially fatal syndrome of hypothermia, rigidity, autonomic instability, and mental status derangement. This is a severe reaction to medications that lower dopamine levels. The primary morbidity and mortality associated with NMS are irreversible brain injury from hyperthermia and renal failure from myoglobinuria, secondary to rigidity-induced skeletal muscle necrosis. If NMS is diagnosed quickly and treated aggressively and appropriately, most people recover within 2 to 14 days. NMS can result in death if it's not treated quickly enough. The mortality rates for NMS range from 5% to 20%. The other long-term complication may have been tardive dyskinesia. Tardive dyskinesia will occur in 30 to 45% of individuals taking antipsychotic drugs on a long-term basis. Tardive dyskinesia is a major problem because in 50% of cases, it is irreversible even when the offending antipsychotic drug is discontinued. TD causes stiff, jerky movements of your face and body that you can't control. You might blink your eyes, stick out your tongue, or wave your arms without meaning to do so. It is believed to be caused by upregulation of dopamine receptors due to chronic dopamine blockade and can result in an exaggerated response to the postsynaptic receptors to dopamine, causing tardive dyskinesia. I truly hope this is not a common occurrence, but it is easy to see why it occurred. These two medications are considered lookalike-soundalike drugs and are to be handled cautiously in data entry and pharmacist final verification. This brings me to the end of today's video. If you like this kind of content, feel free to like and subscribe or leave a comment below if you would like me to go over other medication errors. See you next time.